Hi, I'm Dr. Casasilla with Sarasota Neurology, and Gayland was nice enough to come in today and talk to us about his PRP experience. And he's a very unique patient in that we did both his knees and his shoulders, all 4 joints, and had a tremendous response, but I'm going to let him tell us about it. So I want to thank you for coming in today to talk to us about your PRP experience. Tell me first, what kind of problems were you having before you had platelet-rich plasma therapy?
With my knees, I had a ditch cave on me about 25, 30 years ago, and it was getting to be bone on bone, and just really very painful to walk on.
So you had a lot of knee pain on both sides?
A lot of knee, yeah, both knees. I had two different ditches cave in onto me a year and a half apart, so both knees were really bad.
And did you see another doctor before, did you see an orthopedic surgeon or anything like that?
Only when they operated on, took the cartilage that was loose in there out and retied the ligament. So, I mean, when that ditches cave in on me, I had to get my knees fixed.
So you knew that you had bone-on-bone arthritis?
Oh, I could tell that, yes.
Grading
it took a while, but it's... Yeah. But then the last probably... In fact, I thought I was going to have to quit work. That's one reason. But
so your knee pain was so bad that you were going to have to quit work?
Oh, yeah, I was having a tough time. But I didn't want to do knee surgery. I just said no. And then...
and tell us about your shoulders. What happened to your shoulders?
Just wear and tear, I guess.
Just wear and tear kind of from the same heavy
Yeah, and then you had me get an MRI on it, and I knew it was hurting so bad. I mean, for about a year it was just like that. I couldn't even move. If I moved up and I had above my head or something like that during the night, I literally could not move it.
Raising your arms above your head.
I couldn't even move it. I literally had to pick this arm up to get it back down and everything.
And how about the left arm? Did that bother you?
It was getting that way because, of course, when this was so bad, I started using
the right was worse than left.
Oh, right was 10 times.
And then you made your left arm.
MRI on
you made your left arm worse by helping out the right arm.
Yes, basically.
Okay. So you had both shoulders and both knees. And so how did you hear about, and you didn't want to have surgery, is that right?
I said I'd just quit work first.
You'd rather quit working than have surgery, because you didn't want the risk of surgery.
Yeah, because
infection, people get replacements and then they have pain and then you can't fix the pain. Exactly. Once surgery's done, it's done, right?
There's no other option.
There's no going back on that.
Right.
So you heard about Matrix Platelet Rich Plasma Therapy. How did you hear about that?
Well, I was talking in the choir.
A church.
Yeah, church. When your nurse or helper, she was in the choir, and so I was saying, she said, "Well, hey, why don't you try to see if Dr. Casasilla can help you do this?" So I said, "I never heard of it before."
With PRP.
Yeah, with a PRP, and I said, "Oh, what is it?" And she started explaining it to me. I said, "I've never even heard of it. How come it's not out there where I can hear about it?"
Did you look that up on our website?
Yes, I did all that too. I came 3 days later. I had made an appointment right the next day.
But you went on to prpstopspain.com and looked at the information.
Yes, I watched how that was all done, the procedure and everything.
Was that helpful for you to watch the videos?
Well, sure it was, because I'm kind of a geek for that kind of stuff anyway, how things work. But just as a consumer,
I
thought it was more like a God thing because I'm using my own blood and there's no,
it's natural.
It's a natural type thing.
We're using your body's own healing ability, but we just concentrate it and then re-inject it right back into your own joint. Sterile. Exactly. So the risk of complications there is very low. We do it under surgically sterile technique, and so that appealed to you.
Yes, it did.
Great. And so then you came in and saw me. I remember that.
Right. I did my knees first.
And we did your knees first.
And I said, well,
at the same time, we did your knees at the same time, right?
I did both knees at that time.
Yeah.
And I said, because you wanted me to get MRI on my shoulder.
You couldn't have 2 knee surgeries done at the same time, could you? You'd be in bed.
Well, I had a lady at church that had it done.
Yeah, that's pretty tough.
Tough.
But this was easy. You had both knees done, and there was no recovery time.
No
problem. So you came in, and we did your Matrix PRP therapy, and tell us about that. So you had your knees done.
Well, I had my knees done, so 4 days later, you had told me not to do any stairs or ladders, so I did pretty good on that. But then you said, well, you can go to work, after make sure you don't do nothing for 3 or 4 days.
Right. So you got to rest a little bit.
Yeah, and so I did all of that part. But on the 4th day, which was on like a Tuesday, I went back to work, and they were not bothering me or anything, but I think
Did you feel better?
Oh, immensely.
After the PRP?
Yeah, even after the 4 days, I was feeling good.
That's amazing.
Yeah, a lot of the pain was gone even then.
Oh.
And so, I said, well, let me, do it, but I think I just went too soon to get that jump started.
Because you have a physically demanding job.
Yes.
So you just overstressed your knees. Well, and then you came in at a later time, and we did both shoulders at the same time.
Yeah, 2 weeks later.
Oh, it was just 2 weeks later?
2 weeks after I had the knees done, we had this done. Because you wanted me to get an MRI before I did this, so that took that a little bit of time too.
Well, that was to make sure we didn't have any other problems with the shoulders. Right. But that came out okay. So you had a little rotator cuff problem on both sides.
But that
wasn't little.
That pain was even worse than this pain.
I'm sure it was. And then we did Matrix PRP on both shoulders at the same time.
Yes, and I've never had no problem with that since.
And you walked out of here right after the injection.
After 2 weeks, there was just like things, I exercise them properly.
So your shoulders went right back to feeling great.
Oh, yeah, they're great.
And they've have they stayed that way?
Yes.
So you haven't had any recurrence of your rotator cuff problems?
None whatsoever. None whatsoever.
So, and then I didn't see you I checked you back
about
after
2 years or so.
I checked you back about a week, about 8 weeks later after you had everything, your knees and your shoulders done, about 8 weeks later, and you were doing really well at that time. You told me that. Is that correct?
Correct.
And then I said, well, just come back and see me if you need to see me. And then, well, how long after that did you come back in?
It's been about 2.5 years.
So about 2.5 years, that was before Christmas here recently, right?
Yes.
You came in and said what?
I said my knees are starting to really get bothersome. They were hurting up here, and then I was having a little part back here with ligaments, but I had fallen. Now, that could have agitated my knees again, too. When I fell.
But again, you had bone-on-bone arthritis in your knees.
Yeah.
This wasn't a simple torn meniscus. This was bone-on-bone arthritis.
Yes. Right. I could hear it.
And feel it probably, too, grating.
Yeah.
Right. So you said you wanted more Matrix PRP.
I said, let me try it again.
Okay. And so we treated you, when did we treat you the second time?
It's been about a month ago now.
Okay.
It was January the 5th.
And did you take it easier this time?
This time 2 weeks not doing anything.
Okay.
And I went
just
back.
Routine around the house, just not working.
This time, even the next morning, I could see the difference.
Wow.
Of course, the other time it took about 3 or 4 days, but this one I could.
It was because you took it easy.
Yes.
You didn't go do heavy labor.
Right.
So now we're about a month after the second treatment, 2.5 years later with Matrix PRP on both knees. And how are your knees feeling now?
They're doing good now.
Are they cleared up of pain?
Pain-wise, yes. Discomfort, but a lot of it's not my knees. It's still a little bit back here.
Yeah, but I mean in the actual knee joint.
The knee joints are good right now.
So you'd say they're close to 100%?
Yeah, I would say so. To me, I told my wife.
No, you tell me. I want to tell you.
I know, but I was telling my wife just even this weekend. I said, man, it seems like even this weekend's better than the other. Last weekend, because the uncomfortable is getting more.
Well, you get up to about 12 weeks of healing on one treatment of Matrix PRP. So that's, even though it was just a month ago and you're feeling almost 100%
I'm hoping it
better,
off a little bit.
You got 12 full weeks of healing, so you got another 8 weeks of healing to go. So it's just in there, that Matrix PRP is in there just regenerating new healthy cartilage in your knee joints,
correct,
which has been proven. And so that's just adding more cartilage to your knee joints to help buffer so it's not rubbing bone on bone, and that's why you're getting this tremendous pain relief.
And I really take it easy on weekends when I'm off.
Right, because
I'm really
still healing. You're
exactly,
still healing.
And I want to do as much as possible, so I don't work too hard on the weekends.
Well, that's good, because again, for 12 weeks, although you don't have to really totally restrict your activity, you're a little bit more uncommon for a youthful guy who's 70. You do 10 times more work than most people your age.
Especially like today, doing trees.
So, but that's fantastic. Is there anything else you'd want to share with the people if you're going to tell them about the Matrix PRP therapy?
Well, the only thing I would say, you're going to probably really feel pretty good, so be careful what you do. Don't overdo it if you're an active person.
While you're healing.
Yeah, you don't want to go out and play some kind of a sport because you thought, well, hey, I feel pretty good right now.
You don't want to go play soccer or football.
Yeah, you would want to wait for the full 12 weeks for something heavy. Well,
because
because you're not the bionic man. You still can have things happen to you.
Yeah, but then at 12 weeks, you got the full healing going on, and for you, in your case. But your shoulders never bothered you again.
No, my shoulder's been good.
Even now, today.
Right.
Almost 3 years later.
Right.
Would you say that's amazing compared to surgery?
Yes. If you knew how the pain level was probably 15 on a scale of 1 to 10.
Wow.
That's how bad it hurt.
And went to...
I was taking...
And it went down to what?
To 0 right now.
To 0.
Yeah. I was taking a leave all the time, biofreeze, everything. Jacuzzi, I did everything I could. I have massage, I go to the chiropractor, I do all these things to try to keep my body in shape. And why, if you look back at how in the world I was even able to work, is,
amazing.
Yeah, because it was so hard I couldn't lift my arm or nothing.
So for like a rotator cuff injury or some other shoulder pain or any kind of a knee problem like a torn meniscus or bone on bone, would you recommend Matrix PRP to somebody?
I do it to everybody I see.
What would you tell somebody if they said they were going to have surgery?
I said, we ought to try this first. Go and see him. I say, he said not everybody's a candidate, so you need to find out. But I said, wouldn't you rather have no surgery and have this done? And your recovery time is so much faster besides, and the pain is not as much as when you got to recover with a knee. So, there's a lot of benefits from it. But the main thing is there's no surgery involved.
Right. No general anesthesia, no
Nope,
cutting,
nope.
nothing. It was a simple
Just
procedure.
a simple procedure.
Yeah. That's
So
cool.
I'm very, very happy with it.
So if you had to do that again another 2 or 3 years, would you do it again?
Oh, sure.
Right. Shoulders or knees?
Yes.
Absolutely. Well, that's great. I want to thank you so much for coming in and sharing your story with us.
No problem.